Welcome to Healthy Living. My name is Amy Bouton. I'm with St. Tammany Health System, and we're going to talk today on our episode of Healthy Living about women's health. So May is Women's Health Month, and we want to focus on a topic today specifically on women's bone health. We're going to talk about a few other things, but that's going to be our focus today. So with me right now, I have Dr. Carmina Allaire. She is a primary care physician at our Folsom Clinic, and I want to welcome you today. Thank you so much for joining me.
Good morning. As she said, I'm part of the St. Tammany Health System Folsom Clinic as a family medicine physician. I'm originally from Natchitoches, Louisiana.
Oh, nice.
I went to undergrad at Xavier University in New Orleans, where I majored in chemistry and biology, followed by my master's in public health and medical doctorate at LSU Health Sciences Center in New Orleans.
Oh, nice. Okay.
I proceeded to do my residency at LSU Rural Family Medicine in Bogalusa, Louisiana. And I'm also a U.S. Army veteran.
Oh, wow. And I know we talked before. You and I have talked before. I've had the pleasure of working with you on a couple of things. And I know you have a lovely family, and I know that you like basketball?
I do. So
Okay.
I have been married for almost 15 years. It would be 15 years December 26th of this year. Oh, God, yes.
Wow.
I have two stepchildren, a daughter and a son that are both 16, and I have a 9-year-old daughter who's giving me the blues. She's so active in gymnastics. She keeps us so busy. And I have a 3-year-old who just started his 3-year-old program this month.
Oh, that's
So we're
exciting.
very excited, and he's excited about it.
That's exciting. Well, we're very happy to have you with us at the Folsom Clinic, the St. Tammany Physicians Network Folsom Clinic. Tell me, when you are practicing in the clinic, what's your kind of care philosophy? What can patients expect when they come to see you?
So my care philosophy is, one, as I told you, I'm from Natchitoches, Louisiana. I'm big on rural health and community because I believe that the community together helps build and grow the community, from having parks, recreation, farmers markets, having great production with the businesses there, keeping the community whole. So when the patients come in, I always tell them, this is our get to know you visit. And we start by getting to know their history, their family history, because all these things connect in how we treat them and care for them. What do they do in the community? What are they putting inside their mouths and their bodies to help them with their health? Do they know their medications? Bring your medication list. Do you have social support, family support? We delve into all those things because family medicine is comprehensive medical care.
Okay.
So.
Yeah, and I know that, you know, just hearing you talk and in conversations that we've had in the past, you really have a commitment to that preventative care, which is really important. Obesity-related conditions, you know, finding issues early. And today, like we talked about in the beginning, and you and I have talked about a little bit before this show, we're talking about women's health specifically, because May is Women's Health Month. But we want to focus on a topic that I don't know, we talk about it a lot, but I want us to talk about it specifically today because bone health is very crucial to women's overall health and longevity, right? So let's talk about a little bit about the prevention and early detection of osteoporosis, which is, you know, a condition of poor bone health. Why is it important to maintain the bone health all of our lives as women, particularly as women?
So let's talk about it. So osteoporosis screening normally starts at 65 and older, unless you have risk factors that for postmenopausal, before 65, and premenopausal women. That can include cancer or kidney failure or some type of other bone health disease or vitamin D deficiency and so forth. So we discuss these topics because there are ways to prevent it before medication management, like exercise. This includes low impact, moderate, or high impact exercise, resistant training. For those community dwelling individuals, we tell them to do physical therapy.
Okay.
Occupational therapy. We talk about diets enriched in calcium and vitamin D, or supplementation with calcium and vitamin D. At least for calcium, about 1,000 to 1,200 milligrams, depending on if you less than 70 or above 70, and vitamin D, 600 to 800 international units, depending on if you're less than 50 or older than 50. Some types of things in your diet, increasing your vegetables, citric fruits,
right.
Beans. You can do milk, things like that, yogurt, cheeses, and there's plenty of wealth that we can provide information about those types of diets and recommendations.
So the key is keeping your vitamin D intake up, right, to strengthen your bones.
Exercise,
right.
Appropriate weight.
Okay.
Low weight can also affect a BMI of less than 20, can affect and increase your risk of fractures
Oh, wow.
from bone loss. So healthy weights also.
Okay. So when should we start paying attention to this as women?
So as women in general, you should be in tune to your health all your life. Correct. But although the screening, like I told you, doesn't occur to 65 unless you have risk factors, we should be honing in on our health, our diets early on. We should be making sure we're enriching it with more than vitamin C and vitamin D, but with other vitamins and minerals. We should be exercising. And the goal is at least 5 times a week, but I always tell my patients, start where you are.
Yeah.
Even if it's 1 day a week, 2 days a week, 3 days a week, start with, if it's 10 minutes, start at 10 minutes with a goal of going 30 to 45 minutes to even an hour. But starting there, making sure you're telling your doctor if you had increased falls, or we can review your medication. So we start early because polypharmacy does occur. Some people have multiple medical conditions that require multiple medications for management.
Yeah.
And sometimes we can reduce those and maximize care in different ways. So having your annual visits, and sometimes more than annual visits depending on how many conditions you have and what we're monitoring. All those things are very important, which also leads to why a primary care physician is important. So having a primary care physician, it's like your nucleus, and it keeps you in tune, and we communicate and attach you to specialists if you need that.
Right.
Which include endocrinologists if you have severe bone health disease, or bone specialists, or even for women, your gynecologist if you need women's health exams and things like that. But we can connect you in different ways. Or if you have kidney failure and you require bone therapies, and we have to make sure we do certain treatments if you have decreased renal function.
Yeah.
Or you've had breast cancer, we can't use certain treatments for your bone health, and we can relay this to your hematologist and oncologist or your breast specialist.
So you're the keeper of all
So those things are all important to stay in connection. So having your primary care physician, we take care of your whole health. And we collaborate with all the other physicians. We're all a big team, including the patient. The patient is part of their care.
Yeah, so that's important to establish at a young age. When you're done with your pediatrician, find your primary care. And when we talk about women's bone health, does bone stop kind of, I don't know, how does bone work? Does it regenerate? Does it build? What does it do? How does it function in our body?
So as we age, and depending on, especially postmenopausal, when we start to lose estrogen and things like that, you can start to have bone loss.
Okay.
And a good percentage of the population, at least 10% of the population of adults will experience some type of osteoporosis. At least 2/3 will have osteoporotic fractures, and at least half of those women be postmenopausal. So you can start to have this bone loss. But you can, depending on the degree of bone loss, so we kind of gauge it on, it's a scale, it's a FRAX tool, and we do it by a DEXA scan, which is a painless imaging modality that takes x-rays and looks at how the radiation goes through the bones. And it compares it to the younger population to see what degree of bone loss you have. So osteoporosis is if it's less than -2.5, a T-score less than -2.5. So we look at that, or if you have an increased risk of a major fracture of 20% or more, or a hip fracture of greater than 3% or more. So we kind of look at those things to decide where we go from there. And then we go with certain treatments that decrease bone loss, or we have, those are called anti-resorptive agents, or we have anabolic agents that can produce bone. But both agents will also decrease risk of fracture.
Yeah, so there is a treatment. If you do discover osteoporosis, there's ways to manage it.
Correctly.
Okay, good. And for older women who may have paid attention or may not have paid attention to their bone health over time, what is your recommendation? Like if you're seeing me for the first time and I say, gosh, I've never had a bone density test, I don't even know what my vitamin D levels are. What do you say to a person who's for the first time visiting you or their primary care, and they're like, okay, so what are we going to do? How are we going to address this? How do we get to take care of this?
So the first thing, age. The one recommendation from most of our colleges and our screening task force are women 65 years and older.
Okay.
And then also if they are also less than 65 and postmenopausal or have other risk factors, as I said, they recommend screening. And it's normally, when you start the screening at 65, it's every 2 years if you are at risk for osteoporosis or osteopenia, which is the initial bone loss and then progression to osteoporosis, worsening bone loss. So we would kind of screen at that time. But some people have normal bone mineral density, and the recommendation is like every 4 to 8 years.
Oh, that's good.
Just monitoring, and we just, encourage them to maintain the things we talked about: exercise, the diet management, physical therapy if necessary. Monitor your footwear in home. Watch rugs. Watch your lighting in your homes. But the main thing you do initially when you talk to the patients, like I said, get the history.
Right.
Find out if they have any visual impairment that can put them at risk. Find out if they have any comorbid conditions like heart disease or kidney disease or anything like that that can affect their treatment management in the future. So all those things are important, knowing the history of the patient, knowing what's going on. This is why we go back to having those annual visits, with at least annual visits with your doctor, so we'll know what's going on, so we can have you on the proper treatments and follow the proper screening guidelines for bone health.
Yeah, and as you alluded to at the beginning, preventative. Watching what you eat, watching what you drink, exercise. What's one? Give me one example of a good low impact exercise for everybody, men and women.
So a good low impact exercises, I would say, stationary bike.
Okay.
And I like to use that one because a lot of our patients, as they age, they get arthritis and things in their joints. And I say low impact because they can sit there and they can do it. But if they don't have any problems, I tell them to get out and walk your yard.
Yeah, okay. Yeah.
Get out and walk the driveway.
All right.
Or go to the local park and walk.
Okay.
And I tell them things like that. Even chair exercises with resistance bands, movements, strengthening those muscles, strengthening those legs if you don't have mobility or the capability to get outside the home.
Okay, good. Well, thank you for that. Well, I appreciate you being with us. Is there anything else you'd like to add that we didn't cover? Or that you'd like to revisit?
I would just like to add, come visit me at the Folsom Clinic. If you need a primary care physician, I'm ready and willing, and we can get started.
Okay, wonderful. So I want to thank you guys for joining us. Stay tuned because we will be right back, but I want to thank you, Dr. Alair, for being with us. And like she said, if you need to visit her, she's at the Folsom Clinic, and you can find her information on our website at sttammany.health. So we will be right back.
No bones about it. St. Tammany Health System's Bone and Joint Clinic is #1 in orthopedics. Along with our partner, Ochsner Health, we connect you to the very best care. Not just on the North Shore, but in the country.
Welcome back to Healthy Living. As we discussed in our first segment, we're going to talk about women's health, and we're going to talk about it from the perspective of women's bone health, which is a very important factor in healthy aging and mobility as you age. And we're going to touch on a few things. We spoke with Dr. Alair, our primary care physician. My guest now with me is Sherling Werner. Sherling is the manager of our imaging services. So she sees a lot of images of things that are healthy bones and things that are not so healthy. So we want to talk to you about that, but I want to welcome you first to the show.
Thank you. I'm glad to be here.
Yeah, we're happy to have you. So thank you for coming. So we are going to talk about women's health. We're going to talk about all those important topics and resources that we want to discuss. But first, I want you to tell people a little bit about yourself.
All right. So I am, I've been affiliated with the hospital for about 18 years now. I've been through the imaging department, diagnostic, CAT scan, MRI, before I ventured into a more leadership role. Personally, I've been married 13 years. I have twin girls. They're going to be 12 this year, going on 16 some days, but they keep me busy, super active. So
that's exciting. Twin girls, that's a lot. That's a lot. So, well, I appreciate, again, you being here with us because I think it's important to hear, yes, a physician's perspective from a primary care perspective, but it's also important to hear that imaging perspective because as we talked about for a second, you see what happens inside of our bones through the imaging that you do. And we're focused on the bone health. We want to talk about prevention, early detection, and osteoporosis. So what are some things you do see in women specifically, because it's Women's Health Month, who have issues with bone density health?
You know, honestly, the big thing that jumps out is surprising how many women actually suffer from decreased bone density, and even more surprising how many don't even know they do. 1 in 2 women actually have some degree of bone density loss, and that's 50%. That's a scary number
that's a
if you
big
think about it.
statistic, yeah.
If you think about it. And so you can kind of think of osteoporosis as the heart attack of the skeletal system. It'll often go undiagnosed until a major event like a fracture happens. So we see a lot of that come in through the emergency room, fractures of patients that didn't even know they had osteoporosis.
Wow. That is the way you characterized it, the heart attack of the bone system. I like that characterization because it shows you the importance of taking care of your bones. You don't think about it, but this is where our body lives, on our bones. It lives on our bones. It carries us around. So let's just kind of touch on what can we do as women to detect this at an early age.
So the screening go-to for bone density health is called a DEXA scan. It's more commonly known as a bone density scan. So it's something that a provider will order on patients to look and see if they do have any form of bone disease.
Right. And I just had one done at our Women's Health event. Tell people about it, what to expect when you get that scan.
So it's a very easy, non-invasive scan. So when you arrive, you'll go to the room with the technologist. They'll kind of go over a couple of medical history questions with you to see if there's any other underlying conditions that can lead to bone density loss. You'll lay on the table. There's no contorting into odd positions. There's no IVs involved.
Right.
Depending on if you have any metal in the way, they may have you remove some metal. But you lay comfortably on the table. We take some images of your lower back, usually your hips, sometimes your wrist. If the patient has any metal in the hips, we'll do the wrist as well. And those results, combined with the answers to your medical history question, will help the provider determine, based on your score compared to the population of your age, if you're at risk for fractures.
Okay. So what I had wasn't necessarily the exact same, but it was painless, like you're saying, and very comfortable. You just kind of, I think I did it on my hand, right?
Yes.
Yeah.
So it's kind of a mobile screening tool. So if you have one of those done at one of our events and they detect you may have some bone loss, your provider would then order a full diagnostic one.
Okay. All right. Gotcha. So when you say I go to my primary care physician or my GYN, what do I say to them about, are they going to bring it to my attention, or should I bring it to their attention at an early age? What should we do?
So typically we get a lot of patients that come in for their order with their bone density along with their mammo, because the gynecologist tends to order them together.
Gotcha.
But it doesn't have to be that way. You can have the conversation with your primary care provider. A lot of patients prefer to do that because they have a larger look at the patient's overall health. So the recommendations right now is age 65, and you have it done every 2 years.
Okay.
However, there are some high risk factors that may warrant you having it sooner or at a different frequency.
Okay.
So like early menopause, that means if you have menopause onset before age of 40, they recommend you start at age 50.
Okay.
There's some other health conditions, some endocrine disorders, thyroid, parathyroid disease. There's a list of medications that cause bone density loss. So some anti-seizure medications, long-term use of steroids like you see in pulmonary and rheumatology patients.
Okay.
Some cancer treatments will create decreased bone loss.
Right.
Some lifestyle choices, smoking, excessive drinking, things of that nature, all combined together may indicate that you need to start your screening at an earlier age or do it at a different frequency.
So when you talk about the lifestyle factors and the medications, that just underscores the reason why it's super important to be completely honest with your primary care.
Yes.
They're not going to go gossip about you or do anything with that information. It's private, it's confidential, and it informs the screening decisions that can affect your health later in life.
Right. There's no reason to be embarrassed about lifestyle choices.
Right.
I mean, they have heard and seen it all, and their main focus is to keep you healthy. And if you're not honest and open about it, you really can't take ownership of your health and make sure you're doing all the right things.
Yeah. So it's very important for that. So be honest with your provider. Okay. Just tell them about those glasses of wine or whatever you're doing. So what are some things that you have seen? You know, in the imaging world, so what are some things that you've seen in your line of work that can happen to specifically women, because that's our focus today, because of poor bone health? And we can touch on in men too, but let's just start with women.
So in general, bone health can be kind of scaled on a spectrum where you have normal bone, normal healthy bone. It'll go down to osteopenia where you have decreased bone density, but you're not necessarily at risk of a fracture yet. And then you get down to osteoporosis where it's severe decrease in bone density and now you're at high risk for a fracture. And like I mentioned before, osteoporosis kind of goes undiagnosed often. And so we see a lot of what's called fragility fractures. And those are fractures that occur from a low impact trauma, such as falling from standing or something that wouldn't result in a trauma in a patient that has normal healthy bone or even osteopenic. Those fractures often occur in the spine where you'll get a compression fracture. So this bone will actually compress on itself. The classic, I fall and I can't get up, the hip fracture.
Yeah.
And also in the wrists, actually, from people falling and bracing themselves, you'll get fractures in the wrists, and those patients that, like I said, didn't even know they had osteoporosis.
Right. So we talked, you're talking about how it can go mostly undetected a lot of the times. Is there anything that would raise a red flag earlier on?
Patients that have frequent fractures
Okay.
at an early age,
Yeah.
they will definitely start looking to see why is this patient having the fractures. Other than that, knowing your medical history and reviewing it with your provider would be the only way that they would start looking into seeing if you needed to have any kind of screening earlier.
Yeah. And I don't know if this is an appropriate question, you can tell me, but why do we focus on it so much in women?
Women have a decrease in their bone density a little sooner than men. So throughout your life, your bones kind of go through a phase of building down and breaking up, going back and forth, forming new bone. And normally between the ages of 25 to 30 is when you reach that peak bone mass.
Oh, wow.
And women tend to get it sooner than men. So with that, and with us reaching changes of life before men and decrease in our estrogen, we tend to lose our bone density sooner. Also, lower BMIs can lead to having bone density loss, and typically women, we're always
Trying to slim down.
focusing on our figure, not realizing it could be at the detriment of our bone health.
Yeah. So when you said that we reach our peak in our mid-20s, that is a very important piece of information for every woman that's listening. And why? Why is that?
It is because after that, you're maintaining, you aren't producing anymore to go any higher. So it's really important to put the focus on bone health more in the pediatric, adolescent, early adult years, because that's when you're building that healthy bone. So you can do that by making sure you're getting adequate calcium intake, adequate vitamin D. Vitamin D helps your body absorb the calcium more efficiently.
All right.
Having an active lifestyle, weight-bearing exercises, refrain from smoking, excessive drinking, things like that, so that in that adolescent, early adult age, you build that healthy bone and then continue those habits as you progress through your age.
So you're setting that foundation
Yes.
for the healthy bone.
Yes.
And I remember my 20s, my mid-20s, that was, I wouldn't say it was top of mind.
No.
Right?
No.
So you have daughters. You just told us about your twin daughters. I have daughters. Aside from managing that when they're younger, what are some things you do to kind of instill that in your children, and what should we do to instill that in our daughters?
I try to just talk about overall health with them.
That's good.
They're unfortunately starting at the point where they're talking about weight and things like that with their friends, and I focus on just being healthy. You are what you eat. You put in healthy, you're going to get out healthy. Staying active, we make sure they're involved. They volleyball, softball, they're always in something.
Yeah.
And we make sure before they go to their games and practice, they understand they have to eat something healthy.
Yes.
And how it affects their body overall.
Yeah. So let's talk about one other thing, and this is veering a little bit off topic, and I don't know if you have an answer for me on this either, but I'm going to ask you because as a mom, you might know. What if you have someone who doesn't, because I know a primary source of vitamin D for children it can be milk. But what if you have a child that doesn't like milk?
There's other options. Obviously, the sun is one way to get vitamin D.
Yeah.
So getting outside and staying active. There's leafy vegetables. There's different ways that you can get that. There are supplements. And so as long as you're getting a combination of actual nutritional and supplements to get that value you need, it's fine.
Okay,
It's
good.
fine.
Well, that's good to know.
Yes.
Because I didn't have a lot of milk lovers growing up.
And I have one that's lactose intolerant, so
Oh, wow.
we don't do a lot of milk either.
Yeah, so look for those other options. So is there anything else you want to add on this topic? Anything we didn't touch on? Anything you want to reinforce?
Basically, just I know it can get overwhelming juggling all of life's things as a woman. You're juggling work, home life, kids, all of those things.
Right.
Trying to balance all the screenings and recommendations. Like, how many hours of sleep, how many hours you sit and stand, and you can go on and on. But it's really important to take ownership of your own health.
Okay.
Have the conversations with your provider and make sure that you're crossing all your T's and dotting all your I's.
All right. Well, thank you again for joining us. This was enlightening for me, and I hope it was enlightening for you. Thank you so much for joining us on this episode of Healthy Living, and we will see you next time.